Welcome to City Life. I'm Beverly Thompson. There is a big push across the country right now to make sure that responses by law enforcement and other first responders align with the needs of the community. In an effort to do that, Durham and other cities throughout North and South Carolina are taking part in a study that will help us understand and improve the responses to 911 calls for service. Joining me to look more deeply at the study and why it's needed are Assistant Budget Director for Strategy and Performance for the City of Durham, Monica Chaparro, and RTI International Research Analyst, Brian Agard. Thank you both for joining me.
Thank you for having us, Beverly.
So, Monica, I know you work in the city's Budget and Management Services Department. Tell me just a little bit about your role.
Sure, I'll be glad to. In my role, I lead the Office of Performance and Innovation, which is a mouthful. And we do quite a bit of interesting work for the city. One of the main things that we do is we lead the city's strategic planning efforts, as well as we work with departments to collect and analyze data about their performance. And what we do once we have this data, Beverly, is we use it to lead process improvements, to identify opportunities to innovate city services. And lots of times we partner with agencies in the community with really the goal of how can we maximize positive impact for the community. So really the goal is to make sure that we're operating at the best optimal level.
Okay, all right. That sounds like a pretty big job, but we'll probably talk about it a little bit more as we go on. So Brian, for those who don't know, what is RTI International?
Yeah, so RTI International stands for Research Triangle Institute. And for folks that are familiar with the area, it was actually the original institution in Research Triangle Park. So we have a long history working in the Triangle. And what we do a broad array of research. And I work in the Applied Justice Research Division. And we focus our research on the criminal justice system, and specifically here with policing. So we have a wide range of research projects, and we feel really fortunate to work with the agencies here in North and South Carolina.
Okay, so let's just get into the study now. Monica, start us off by telling us exactly what the study is about.
Really, the study is about analyzing 911 calls to see if there are certain call types that perhaps the police department in particular is responding to, that perhaps there's another agency that would be better positioned to respond to those calls. So really starting with data and looking at what are the demands for our public safety resources, and seeing if there are better places or better ways that we can meet that community demand. So there's really three primary goals. As I mentioned, one, analyzing the calls for service data. This project really is focused on having data inform our decision making. So after we analyze the data, really look at alternative responses, and based on the call data, identify if there are certain responses that we want to pilot to see if they can be responded to by another entity or in a different way. And then lastly, evaluate the effectiveness of those pilots. We want to really see if what we're trying, whether it's working or not. So that's really what the study is about. It includes us here in Durham, as well as 6 other cities throughout North and South Carolina, as well as RTI.
Okay, so all of us are familiar with all of the happenings last Sunday involving the police and black males. But can you tell me a little bit about why the study is even being conducted?
Yeah, to your point, Beverly, this past summer, we heard a lot of cries, a lot of demands for governments to really look to see if there's better ways to handle calls, emergency calls, and emergency calls involving police. And this really aligns with Durham's longstanding commitment to continuous improvement. As I mentioned earlier, the office that I have the pleasure of leading, the Office of Performance and Innovation, we lead a lot of process improvements, a lot of continuous improvements. We partner with departments to see if there are better ways to do the services that they deliver. So this study is right in line with the city's longstanding commitment to ensuring we are performing at our highest and best levels to meet the community's needs.
So Brian, tell me about your organization's role in conducting this study. How do you make it happen?
Yeah, it's a nice story, and I'd like to tell it with Monica if she'd allow. So when this all began, we were doing work originally with the city of Durham on a project that was focused on better serving vulnerable populations and specifically individuals in crisis. So when we were doing this work, RTI is an organization in the Center for Policing Research that I'm in. We wanted to make sure that we had our voice be heard out there and make sure that we were demonstrating that we're receptive to the calls that people are making about asking for accountability from government and accountability from law enforcement. So we felt that there was a responsibility for us to chart a path forward for using data and using science-based solutions to determine exactly what Monica had mentioned. What are the resources that are needed by the community, and what's the best way to align those two things? So the city of Durham showed a tremendous amount of thought leadership and innovation to A, develop the cohort, and B, reach out to partners like RTI to say, we need an independent entity to help us evaluate these things and vet the research to see what the most appropriate path forward is. So I feel like we're really fortunate to do that, and something that began with conversations over the summer has developed into a really cutting edge and progressive research and evaluation project that RTI is really proud to be a part of, and humbled by the thought leadership in the city of Durham and the initiative that they took.
Mm-hmm. So it sounds pretty unique that cities often use a lot of data to make decisions, and it looks like Durham is leading the way with all of this. So Monica, how did all of this come about? And tell me which other cities are involved.
Sure. This past summer, our city council requested that staff look at 911 calls to determine what are our community needs, what are those requests. And our then city manager, who's since retired, Tom Bonfield, was really supportive of staff building out this ask from city council to make sure we were, again, maximizing what we could get from this study, from this journey. So came across an article that RTI wrote this past summer, and developed a project plan that was really heavily influenced from that article. And we quickly realized this is the type of project, or journey is what I've been calling it. This is the kind of journey in which you benefit from having more people around the table rather than fewer. And we knew that your cities were challenged to find better ways, or evaluate if there were better ways to meet community needs, just like we were. So we invited them to the table. We were so gracious that they accepted our invitation. We then reached out to RTI as the thought leaders, and we told them, hey, we read this article. We have some of our peers. We want to go on this journey of having a data-driven, data-influenced look at how providing public safety services. And RTI, they were enthusiastic about partnering, and here we are. The other cities that are participating include Raleigh, Cary, Burlington, Greensboro, Winston-Salem, and Rock Hill, South Carolina. So great group of folks. I think when I last calculated, over 1 million or so people live in these cities. So we're excited that they're on this journey with us.
Mm-hmm. So were they chosen because of their similarity to Durham, or just because of the similar challenges we face?
So I wish I could say it was a very scientific ask. I have worked in a lot of those places. So I knew folks in those organizations. Our manager knew a lot of the managers in those jurisdictions. So really using our professional network to reach out to folks to see if they would be willing to take on this uncharted journey with us. So it wasn't scientific. We knew we wanted folks who were in the South, who operate in similar regions, similar geography. So we knew we weren't necessarily interested in a national cohort. We wanted to were near us. And we're so grateful that they accepted our invitation.
Okay. So Brian, let's talk about the nuts and bolts and the process. Tell me about how this study is actually being conducted.
Yeah, and if I may, I just want to say there is one thing that is similar across these very diverse cities that have different challenges and different opportunities to overcome them, is that in each of those jurisdictions, there's a very engaged and very hardworking and a willingness to be innovative in all of those local governments. And I think that's kind of the steel thread that keeps that cohort together. And it's very impressive to see. And because these cities are so diverse and are overcoming different types of obstacles, we really needed to create a project plan that would be flexible and accommodate their needs. And so there's 4 phases in the project plan that we're working through now. And folks, Monica likes to use the analogy of we're running a race. We're all starting at the same starting point, and we'll get to different milestones at different times. But as long as we all cross the finish line, we're going to be able to accomplish the goal in all of these cohort of cities. So for the 4 phases, the first one is the collection and analysis of 911 calls for service data. So we analyzed 3 years of call for service data in the city of Durham. It's right around 1 million calls for service. So we're talking about a large quantity of data. Understand what law enforcement's doing, what are the demands of the public, and how are those responses looking currently. We looked at that in the past 3 years, the past year, and the past 90 days to be sensitive to all of the changes that we're currently experiencing now. The second phase of this is something that we're underway with right now, and that's a scan of literature and practice to understand the entire universe of potential alternative responses. There's a lot of great coverage in the media about some of these potential pilots and some of these alternative strategies, but it's really important for us to understand what resources are required to support them to make sure if we adopted one of these strategies that it would be feasible. And in addition to that, is trying to understand the evidence base around it. Do these programs do the types of things and have the types of outcomes that local governments want? So that's the second phase that we're working through currently. And then the third and fourth phase are really right in RTI's wheelhouse. And that's to help with the implementation and the evaluation of any of these alternative response strategies. This was a really important component to the city of Durham and Monica that said, at the end of this, we need to be able to measure this and understand the outcomes that we identified at the start of the project. Are we achieving success with those? Because that's when we need to identify whether these pilots need to be scaled or if they need to be redirected into maybe a more productive path. So this really rapid implementation and evaluation is critical for us to meet the urgency of the situation and be as responsive as possible to the folks in Durham.
I see. So just for clarification's sake, is the 911 call center's handling of the calls being looked at as a part of this, or is it just the response by the first responders?
Yeah, so you're right. There are 2 opportunities here for potential interventions. One is in the field with the folks, the first responders, law enforcement that are responding to the calls, and the other is at point of dispatch with the emergency communications. We have a partner, RTI has a partner, and is a partner as well to the city of Durham, the University of Chicago Health Lab. They do a tremendous amount of research that's focused on the 911 emergency communications component of this work. And we are approaching this as a comprehensive from beginning to end, from the time that a citizen places a call to the end of that response. We're considering that entire set of interactions.
Okay. So, Monica, what does the city of Durham hope to do with the results of the study? And what is expected to be accomplished by all of this?
So there are a couple of things. The very first and minimal level of what we hope comes about is that we provide City Council as well as our administration with useful data as they contemplate this really challenging question that's really uncharted of what are opportunities for approaching public safety differently in the future. That we provide them with data, research, some good pilots that can point to approaches that both meet the community needs while still ensuring the public safety in a manner that aligns with our community values and also aligns with the resources that we have available in our community. And lastly, it's an ambitious goal, but we hope that we can serve as a blueprint for other communities that are tackling the same tough issue. Isolated to us, it's not isolated to the Carolinas. So we hope that this methodical approach that we've taken can really serve as a resource to other communities across the country.
Okay. So, Brian, where is Durham currently in the phases of the study, and what has been accomplished so far?
we've come a long way since the summer, and they've put in a tremendous amount of work, both city staff and staff at RTI. So we're in phase 2 right now, and soon, in the next few weeks, we'll be presenting the alternative strategies, the research and the literature and practice review that we did to city government and city stakeholders so that they can get a sense of the menu of options that they have. And phase 2 builds off of phase 1, the analysis of the 911 call for service data. So it's important that we're matching what's been seen in the data and from that analysis, communicating that to stakeholders and decision makers in the city, and then saying, here are the menu of options. In addition to that, in phase 2, we're scanning and inventorying resources that are available in the city. We want to make sure that any of the responses that are implemented are feasible and that the infrastructure exists for them to be successful. So here in the next several months, we'll be moving into the implementation and evaluation of the alternative pilots. And we hope to be pretty nimble with that and start to evaluate as quickly as possible to make sure that we're being as responsive to the needs of the partners in the city and the folks in the community as well.
So Brian, can you talk about what some of the key takeaways are so far?
Yeah, so there's a few different things that we've seen in the data. One of the major takeaways is that roughly 50% of calls are for directed patrol or for general assistance. In a directed patrol, it's important to note that there's not just 911 calls for service that come from the public that are recorded in this data. It also records proactive police activity, so the things that law enforcement are electing to do. One of those things are a directed patrol, which is a patrol in a specific time in a specific place to make sure that public safety needs are being met or being responsive to the community. And general assistance, the other category that makes up a broad portion of 911 calls in Durham, they have a wide range of call natures within. So anything from a barking dog to something like littering or trespassing. So there's a wide range of things that fall under that. And the other main takeaway, and that we've been working through here, is how relatively rare outcomes like arrest and use of force are. That's something that we're exploring now. And when we're thinking through what are the key outcomes that we want to see for public safety in Durham, I think those are a couple that are much less prevalent than some folks that are not familiar with the data may believe.
Mm-hmm. So, Monica, how is the study actually being funded?
So this is a story I love to tell, so thank you for asking that, Beverly. So the Office of Performance and Innovation, we have grant funds and some money that really are used to pilot innovations. So we used a portion of that money to initially kick the study off. And then as we started to build out this project a bit more, RTI was able to connect with a national funder, a national philanthropic organization who really specializes in helping organizations tackle some of our country's biggest challenges. So Arnold Ventures is actually funding, providing support directly to RTI, financial support, which is a tremendous help to local governments right now, to our particular local governments as we set out to do this work. So that was a tremendous find that RTI brought to the table, and we're excited to have that financial support.
Well, congratulations. That's great. So, Brian, let's talk a little bit about the information that you are getting from not just Durham, but all the cities. Will it be aggregated for a more general application and use, or is the information from each city being seen as applicable to that one location?
Yeah, so I think there are a couple benefits of the analysis. So while the cohort of cities is a diverse group, it's not necessarily representative of the United States as a whole. So that being said, I do think it will say something about what's going on regionally in the Carolinas. And I think it's useful for benchmarking and comparing across cities to understand what's going on across these jurisdictions. But I do think the main benefit is really for what is happening in these cities specifically. So the conversations that we've been able to have by reviewing this data, cities are asking and answering questions that are specific to their jurisdiction, and we can be really flexible with the response for that. We presented the first set of analyses to the city of Durham. They've had an opportunity to review that. That review prompted a number of other questions that we went back and we reran some analyses that were specific to Durham, and we're working through answering those questions now to make sure that everything in their data is understood in the context of the local jurisdiction.
Mm-hmm. So, Monica, for Durham, how can people find out more about the study and actually keep track of the study results as they are known?
All right, great. We provide updates, including all of the presentations we give to City Council, all of the reports that we give to City Council that are produced by RTI on our Office of Performance and Innovation website. So people can visit durhamnc.gov/4366, and it's the first project listed.
Okay. All right. So, Monica, just one more clarification question. I was wondering, after you get all this data, is this meant to just give city council direction, or is it meant to just say, here's what's happening, here's what we know, and you can use this to make your decisions about policing in Durham?
Yeah. So we've been viewing this as a great collaboration. So our hope is that we provide City Council data, and then we have really robust discussion about that data. They can ask any clarifying questions.
Mm-hmm.
Administration also will have questions. And based on answers to their questions, the data really help them make decisions about which pilots we will implement. This is not an academic exercise. The point of all of the research, all of the data is so that City Council and the administration can select a pilot that's unique to our needs and really speaks to Durham's needs. So it's very much an action-oriented study. We're doing due diligence to make sure that our actions are informed by data.
Sounds like a really trailblazing study. I mean, it's just amazing. And we appreciate you guys working on this study on behalf of Durham. Is there anything else that either of you would like to add?
I think we've covered everything. I would tell people to stay tuned, visit our website, and just want to thank you, Beverly, for giving us this opportunity to be on here and really talk about this important work.
Well, thank you both for joining me. I really appreciate you taking the time to do it. And we wish you the best of luck in this study, and we can't wait to see what direction it provides. That does it for City Life. Don't forget to follow us on social media, watch us on Durham Television Network and on YouTube, and listen to our podcasts on iTunes. I'm Beverly Thompson. Thank you for joining me to learn more about City Life in Durham.